Okay, hi everyone. So it's great to have everyone here for our Clinician Engineer Virtual Reality webinar. As you know, through our education platform, we put on regular webinars for everyone's benefit, covering medicine and engineering and the interface between the two. It's an absolute honor to have trainee Dr. Yusra here live from Qatar University to talk about all her work and expertise in the field of virtual reality. And I will now hand it over to Yusra to commence.
Hi, everyone. Hope you can hear me. So I'm Yusra Magdi. I'm a fourth-year medical student at Qatar University. And I also do research within the realm of virtual reality and medicine. So I try to do a little bit of both whenever I can, really, whenever I find the time. It's a bit tough progressing into the clinical years now. And today I'm just going to be presenting let's say, a very short, nice overview of VR in medicine, you know, how you as a doctor or a trainee doctor could benefit from this kind of research, how to break in per se, but also most importantly, the current work that's been done. And again, of course, my experience with the field, how I got in and so on and so forth. So, this is just a very, very quick introduction about myself to start with. So the contents of this presentation, again, like I said, very simple. We'll just take it quickly from what VR is, a brief history, and then research work in virtual reality in general within medicine, research work at my university and work that I've done, and then my personal experience, how I think clinician engineers can benefit. Of course, then we'll have questions and references. Hopefully we'll be able to do everything within the time limit. Okay, so who am I? Like I said, very quickly, again, I am a fourth-year medical student. I've also worked part-time at the virtual reality section of my university for a bit over 2.5 years. I stopped early summer of 2021 when COVID really hit and, you know, exams hit as well. So you have that. But I'm also currently the student lead for the VR and AI interest group at my university. And so we do a monthly thing where we come together, we review the latest updates or, you know, the latest changes on the scene for VR or AI or, you know, all the health tech in medicine. And that's been really exciting as well. I also do a bit of research on that front. All right, so we'll start with a very nice, simple question. What is virtual reality? And ideally, I would want the audience to butt in a little bit and tell me a bit more about what they think. What do you think VR is? Whatever initial idea that you have of VR.
Good question. I would say something that technically isn't real, but is real at the same time. Does that make sense?
Exactly. So there are so many definitions out there, you know, explaining the whole, the tech behind it all. But I think a very nice, simple definition that we can go through for today would just be an alternative reality. And virtual reality really just goes under the umbrella of XR, or what is otherwise known as extended reality. And so that would have all sorts, you know, you would have mixed reality, you would have AR as well, you would have, okay, hold on. Let's actually move on to the slide we were actually at. Spoilers everywhere. So you would have AR, you would have VR, MR, and there are all sorts of acronyms coming out as we speak, actually. But the general idea is that we are being immersed in something that is alternative to our current reality or anything that affects our current reality in any way. So for example, AR doesn't necessarily put you or immerse you completely somewhere else. You know, VR uses these what people call goggles or glasses. So with me here, I have today our companion, the Oculus Quest 2. But AR would just be you on your phone. Let's say you really like Star Wars, and so you install the Star Wars AR app, and suddenly you have all your favorite characters on your desk. You just look at them through your camera on the phone. That kind of thing, really. Again, I thought it would be really nice to just go through a brief history of VR and how things really started. I won't bore you with the facts. We have so much to cover in so little time. But I looked at the phases which I thought were most significant as to virtual reality in medicine, to be more specific. So with us here, right here in 1960s, this is one of the very first systems, right, created. Now, this was created just to experience one game. And you can see how everything's really, let me see if I can get a pointer. Hold on. Let's actually get the thumbnail view hidden. Okay, this would be nice for the rest of the presentation as well. So you can see here how you sort of just have everything hanging off from the ceiling. And then we have the man here just standing, and you see how uncomfortable the position is. And it's really just what I believe it was an experience of a few seconds. Again, we don't really expect much in the 1960s, but moving on, 1980s, I believe. This was when you had all sorts of predictions as to where VR could go. And this was where it was the hype. People thought that it would take 5 to 20 years for VR to become this big thing, something used everywhere, which, well, eventually it did, but it did take time because basically it was mainly a money issue. It costs a lot at the time to get a VR headset. This was one of the very few in Dr. Jaren's lab. And right here, I actually have a snippet of one of my favorite, sorry, I'm looking this way because that's where the main screen is. This is where the camera is. So sadly, I can't look at both at the same time. But right around here, you actually have a snippet of one of my very favorite articles on the history of VR. So this talks all about Dr. Jaren's lab and his predictions and basically where he thought VR would go. And he was actually right for the majority of it. There's still a few things that didn't happen per se. Who knows, maybe in the next few years, right? But most of his predictions were actually true. Some of them were actually leaning more towards haptics, for example. So here, he thought that you could have some form of bodysuit to complement the headset, where basically all your movement would be tracked. And we actually have that now. All these were all over, all over his work. His work, I think he spanned right between like around the 1980s to the 90s-ish. That was like the peak. The majority of his articles were around that time. But then right around here, you actually have Sony's 90s. In the 90s, they actually came out with this headset, which was a huge flop, sadly. It only could carry around 4 or 5 games and nobody would buy it. It was way too expensive. But then now you actually have other more affordable, nicer, more cost-effective solutions like the Oculus Quest 2. So the Quest 2, you can see, very portable. I don't need to connect it to a computer. I don't need to actually I don't need to stand and wait for something to ascend right from the roof and then I put it on my face. It's just, I have my Quest 2, I have the controllers, I could exercise, I could open up an anatomy lab, I could do surgery, or what I call pseudo surgery because it's not really real, per se. But yeah, that would be it really. There's a lot on the topic, but again, I won't bore you with the facts. You'll find a lot of papers. I put some of them in the references. So if you're interested in that kind of thing, they're all there. I wanted to kind of very quickly give an overview of XR in healthcare. So I'll take you through these images one by one. So here you have a surgeon watching operations as if you wielded the scalpel yourself. So you're actually able to assist in an operation or assist to the success of said operation using VR. Now that could be in many of multiple ways. The one which I'm most familiar with is actually training surgeons or students to do a specific surgery on a certain sequence, right, before the surgery actually happens. And I think that's one of the most common ways VR is used in surgery. We'll look at that later. But then another way is actually relaxing patients with medical VR. So you put them through experiences that are therapeutic in a sense. And I think we've seen a rise in that lately with all the, yoga-based VR apps coming out for everyday home use. You also have VR apps that put you through a person's, so they basically show you what a person with, let's say, autism goes through on a day-to-day basis, then a person with bipolar, a person with depression. I think that really helps with the empathy aspect of it to us as physicians and also as caretakers, right? Again, real conferences, and this is very exciting. I've experienced this personally during COVID. There were a lot of conferences that I actually got to attend via VR. I think the most exciting would be the 3D Organon VR anatomy lab demo. So it was the very first time I tried an anatomy lab on VR. And the best part is I actually got to try it with people at a completely all over at the other side of the world. They were all at Stanford and I was here in Qatar at home in a VR anatomy lab. That was the start of a lot of things that we'll go to. And of course, you could help physicians experience life. Like I said, as somebody else, could be the elderly, somebody with depression, bipolar, so on and so forth. Again, another way is to speed up recovery in physical therapy, right? So neuro rehab VR is a very common example. It's actually, it's gotten quite popular over the years, and I think it's probably the standard right now for rehab that's like neuro-related rehab. It's probably the standard right now. I think also because there's not a lot of apps out there that really cover this. It's very difficult to create applications, in my experience, that actually need a lot of integrated patient feedback over the while. So when you see apps like these, you really think that is a lot of effort put on their part. Okay, now I'll very quickly move on to my research work in VR at QU. So like I said, I've been working at the VR section for almost 3 years now, and I got to do so much as a medical student there, and as somebody with experience actually working directly with the code required and working directly with the softwares required to build such modules. So I work mainly with Unity, which is a game engine. So Unity can also be used to build your regular games, but then again, also VR experiences. And VR experiences are just almost the same. The process is almost the same as building an actual game. I got to actually create models from scratch using references. And so that would require the use of softwares like Blender, Sketchfab, and Maya. So Blender and Maya were two big things. And these were the ones I got familiar with. Of course, there was a little bit of a learning curve, but I think previous experience as a freelancer also helped in. Now, lots of cool things we got to do. So here, for example, we have a medical student trying out a surgery simulator for an appendectomy. It's an appendectomy that we had. We actually wanted to get feedback as to how easy it was to use from med students before we went on and cross-checked it with consultants, because we thought it was more important to see how accessible the module was first. Here, this was one of my very first papers, and I think one of, if not actually my favorite paper. We basically did work on what we call the VR COTI. So the VR COTI was a project I had with Professor Susu Zoraye. She's an associate professor of microbiology at my university. And what we did was, with her help, she gave me a scenario, as in like a story on antibiotic resistance and how it can affect patients with UTIs. And I took that story, that framework, we mapped it out together. It was a work of a few months. And then I took that and I created a VR module out of it. Everything was from scratch, including the models, you know, the sounds, the animations, so on and so forth. Of course, we also had the help of experts at the VR section and the help of more experienced people. And like my brother, actually, is very good at this stuff. Here we had regular events from time to time to sort of slowly introduce VR into the med school. So this was at the charity event where we used VR to put doctors in the place or seat of refugees, and to see what it's really like here, research conferences and so on and so forth. But my point is, the whole point of this slide is that there was so much done in terms of creating the modules, but what I found more effective was actually telling people, spreading awareness about this kind of methodology in teaching medicine, because it's not, or at least from what I know, it's not well established just yet. And so if you're trying to convince people to take it up and to consider it just another regular way of teaching medicine now, then it's best you start with the small things, and you start by showing them exactly how this could actually be integrated into their lives as medical students, as trainees, student doctors, even physicians, proper consultants, right? And so moving on to the next slide, I'll just talk very quickly about the process that goes behind creating an actual VR module, and I'll use one of my initial works as an example. So this was the VR COTI module. It's a long name, but it's short for Virtual Reality Module Depicting Catheter-Associated Urinary Tract Infection as Educational Tool to Reduce Antibiotic-Resistant Hospital-Acquired Bacterial Infections. And now this work I did with a telecommunications engineering student, Mohammed Majdi, and Mohammed Ali Hammami, the virtual reality section head, as well as Dr. Susu Zoghayr. And it was actually quite well received. We got to actually publish at, we actually shared it at a conference, and I think it was the IEEE. It was the IEEE IoT conference in 2020, I believe, and we actually got to get on their database later on, which was super cool for me. It was like, oh, I finally got a module out there. What was really unique about it is that it was a module created by students for students. So, and having a medical student also directly working on the creation process really helped, in the sense that we were able to ensure that it was as medically accurate as possible, whilst also ensuring that the tech part was cleared. And I think that's where it's nice to have two hats. It's, again, you'd also need experts in each field. So for the medical part, we had Professor Susu, and then for the tech part, we had two other members on the team, both Mohammeds. And then there was me in the middle, two hats, just trying to put it all together. So I'll just very quickly take you through the process and how things really work. So the typical framework, or the typical process for taking an idea, bringing an idea to life, in a sense, would be, number one, you sit down with the doctors, the professors, in this section, we called them the client. We used to serve the entire university, and all biomedical projects would come to me because I was the med student that could understand the science behind it all. So I would sit down with said client, and we would begin mapping things out. I'll show you an example of a typical presentation that a person would come with later on. But basically, we'd sit down, we'd do some discussions, and then I would start slowly planning out the different 3D modules required. And this is pre-production. I'm looking at all the models that I'd need, all the 3D models that I'd need, so all the assets. I'm looking at the sounds that we'd need to integrate. I'm looking at potential animations as well. I'm looking at different camera angles. And here I have an example. So for this module, we had to put the person in a giant bladder. Before you actually put the person in said bladder has to exist. So I would plan it out here. I'd create a small, now this model, it changed a lot over the process of creation, but this was the initial draft. Create a small initial draft, not something that would take a lot of time. And then I would start mapping it out. So front view, side view, where the player would be, where the person would be, what the inner walls would look like, another front view. And this is where it helps to really have a medical background, because I could always just reference my medical textbooks. I could reference other existing 3D models. I could use other existing 3D models, but then again, for work that's to be published, it's better to always have everything created from scratch so that the entire module completely belongs to you, and to avoid copyright issues, of course. So this would be called environment component 1, the bladder. And then we would move on to other environment components. And then it would come to the texture. So, you know, what do I want the inner texture to look like? And again, lots of programs can help you with this kind of thing. Blender itself, which is a 3D software, has a feature where you can sort of design directly, or in a sense, you could, the way I do it, everybody has a method, but the way I do it is I would use a graphics tablet and I would directly draw or directly plan out. And of course, it's a trial and error thing. You also have to make sure that, you know, it's as realistic as possible. So when we first planned this one out, the veins looked too congested. It looked strange. The veins were popping out, and that's not how they're supposed to look. So it took some trial and error to really get or smoothen things out. Again, it's not only direct drawing per se, it's also really manipulating the software. So it comes with a lot of options, there are a lot you can do. And I think that's where there's a learning curve, especially for medical animations and medical designs and whatnot. Again, you have other pieces of software that can help with this sort of thing. It really depends what you're most familiar with and what you're most comfortable using. Again, here we would then take, so this is the same model, same exact bladder. We took that. You actually have to place the camera in the right way. So here, for example, this is where I wanted to place it. The green, I always use green equals player or person. And so I placed this right here at the bottom. And so we would just experiment with that. Using Unity is basically half of the time you're just on your headsets going, oh, okay, does this look good? Does this look good enough for the person who's going to see this later? Is it comfortable? Height-wise, can the person adjust? And so on and so forth. I think what was really unique about our paper, and a little bit, I'm telling myself a little bit here. So what was unique was that I don't know if there are any other papers that describe the process of creation the way we did. I worked on the manuscript myself, and especially the methodology part. And from start to finish, almost every single step and every single trial and error piece was detailed. So I actually think you could try and replicate the entire module using the paper as a guide. And I think that was quite unique about it in a sense. And that's probably why, I mean, it went on to win 2 different awards in 2 different ceremonies, which was quite nice. So we won best demo at the conference. And then again, we won best poster at the annual research forum of our university. And it wasn't even in medicine, it was in IT and tech, which is something I'm still quite proud of, because you'd expect a medical paper to go under, you know, medicine mainly, or at least a paper with half the team on medicine to win something related to medicine, but it won an IT paper, which meant it competed against all the other IT related works, student works in that year. And so that's still something I'm very happy about, even though it's been 2 years. So where it all started, back in high school and maybe first year-ish of uni, I used to do a lot of freelancing in 3D. So this is some of my initial work. I used to freelance for artists here. So you'd have furniture designers coming in with their designs. I'd map it out like so, and I'd create like very nice IKEA catalog looking designs. And it was just a hobby, a nice hobby that also gave me pocket money. But I never actually thought that I would get to use that in med school. I thought it was something that I would keep separate from med school, something that I would do over the summer for a little extra money or so. But I think summer of 2019, there was a job opening at the VR section, and I showed the head at the time a few of my works, and he's like, okay, we'll try to find something you can do within medicine, so it's still related to your major, but at the same time, it's good that you have this kind of experience. And so these were mainly created using Blender. I wasn't very familiar with Unity at the time. It was mainly 3D modeling that I was good at, but that really helped with Unity as well. And of course, over what, almost 3 years, you start really sharpening your claws per se. I even went on later to do Unity courses, take certifications as part of my work. And yeah, it's been a journey. This right here, this image is the first image that got me my very first research work out. So I showed this to Dr. Susu one day after a lecture, and I told her, oh, I designed a microbe that looks exactly like my initial, a Y. She was like, that's cool, let's see what else you could do. And that's basically where it all came from. I remember I talked a bit about pre-production and how clients come in with ideas and examples. So what I'd usually say is, why don't you create a small presentation of what you want, and then we can come in and we can map it together and we could take it from there. So this was, there was a chemistry, I think it was some form of chemistry marathon, something like that. And that was back in 2019, so I'm not exactly quite sure of the name, but they wanted a VR experience on the Big Bang. And so she came in with around 7 slides on, how she calls it a video. So she says the beginning of the video, a Big Bang. So she's like, the video starts with a black empty background. I want the speaker to say, wait for it. We would use AI generated voices, or we would ask them to just, if they have the equipment to record whatever bits and pieces they want integrated, show the formation of atoms, and then small particles arrange here, this happens there, and so on and so forth. And so you can see that having, this is all, I think, A-level chemistry worth material.
Absolutely.
And yeah.
Oh, continue, sorry.
Yeah, so I'm saying this is all A-level worth chemistry, like A-level chemistry material. And so, well, having gotten into med school, I already had my A-levels and AS levels in chemistry, bio, math, and so on. So this was all right for me. I'd mainly get medicine-related clients, but occasionally also had sciences. And so as the science person, I would also take on these. So this was all on the Big Bang, and it was easy for me as somebody with a background to understand exactly what she meant. And I didn't need elaboration as to what is a neutron, a proton, an electron, things like that, that somebody with a completely tech-based or VR-based background would perhaps need to, refresh their minds on a little bit. So moving on, I'll talk a bit about the current research. I've tried to kind of summarize the current landscape as to the research that's actually available right now. And so I've come up with 3 different sections. First would be medical education. So a lot of the research out there is on students trialing out specific VR modules or apps, and them giving some form of feedback. So they would usually be like small student groups, and you would just have, you'd have actually a lot of papers. The majority of the papers that I've seen go under this. But then you have medical students creating modules. Again, this is where our paper was kind of unique in the sense that you did not really have a paper out there with a detailed process as to how the module was created. Now, you might also think, okay, it describes the process, but where's the value, in a sense, as to the assessment of said module? I think that one of the best things about publishing within VR is that you can actually publish each step. So created the module, that's a paper, and it's useful because if anybody else wants to modify the module and they have the experience, you know what? Here's your guideline, go ahead. But also it's proof that you can have such things integrated into the medical curriculum. I mean, if a medical student who has to study 15 to 30 hours a week could find the time to create a module explaining antibiotic resistance during the semester, then if another med student also has the same skill set or works on creating the same skill set, they could also do it. And then you have impact on education. So these weren't really related to assessing the module itself or its efficiency, efficacy, and whatnot, all these different scales. These were related to whether or not VR was actually, from a financial point of view, whether or not it was feasible in medical schools and so on. So you also have that type. Again, most common would be students trialing it out and then the impact on education. Next, we have one of my favorites, clinical settings. So this would be virtual reality being used in OSCEs, which is something they do in our med school here. Patient simulation, simulation in general. And I'll show you a few papers from each category as an example in a bit. Therapeutic VR as well. So this is very exciting, therapeutic VR, and there's a lot of new work being done. You then have surgery. This is also the big one. So neuro, cardio, cardiothoracic, and so on. I feel like this probably also gets the most media attention because usually, you know, you have all these cool pictures, surgeons wearing goggles inside the operating theater. And it's like, oh, they're consulting a surgeon somewhere else somewhere in a completely different part of the world. Or, oh, he's actually practicing the skill right before he does it on the actual patient, or you know what, he's able to see exactly where the nerve or tumor or whatnot is. And so that's very cool. I'll show you a few examples. So again, for medical students creating modules, we have our VR COTI paper. You have the virtual reality in medical students education. This is a very nice scoping review that was published actually quite recently, I think a month ago. That's why I put it here, because I feel like it's the most relevant right now. It was published in Frontiers, and again, all links are in the references. And then, of course, you have specific software. So 3D organon VR anatomy. There's an entire article detailing this piece of software, and then even more research papers talking about assessing it, in a sense, in small student groups. And it's actually, in my experience, I think I've used this software at least 3 times a week on average last semester, because we had the musculoskeletal unit. And so for that, I had to, you need to memorize all the muscles. And the way I did it was I put on my headset, go inside the VR anatomy lab, and I just start piecing, taking out all the muscles from the human model in front of me. And I just start, labeling them in my head. This is this and this is that. And it's just, it's not something that I would say, it's quite a privilege. Not all medical students get to do it. You need to have a headset on you. But at our medical school, what I've been trying to do is so we follow the PBL system. So what I've done is I've taken anatomy each week, and each week in anatomy, I wouldn't prepare a presentation like everyone else. I would just use my headset, and voila, everybody gets to enjoy the experience. And we just, we try to take turns, or sometimes I try to bring more than one headset. The best thing about this piece of software is that it lets more than a person use or be in the same lab at once. So I could be there explaining a certain muscle group or so on, and then I would have the other person with me inside looking at said models. This would help because, again, in COVID, it's really hard to actually access the labs, and places with a lot of students usually get closed and they're not always open. So this really helps. But then again, there's also the tech factor to it, the oh my God, new tech. There's so much we could do with it. So that also grabs the students' attention, and you get them listening, which is in itself is an achievement. Again, in terms of clinical settings, there is and I might be a bit biased putting up this paper here, but it's on the past, present, and future of simulation in internal medicine. This paper I wrote with Dr. Leslie and Dr. Sven at Mayo Clinic. And we talked a bit about how simulation can be used in internal medicine. A huge chunk of it was also virtual reality and how it's currently being used as of the time. So the last update was 2021 July. And so everything as of July 2021, we tried to put in there. It's quite a nice article on StatPros. You can find it on PubMed. Again, so many other articles on all sorts of different innovations coming out on the daily, actually, because there are so many VR startups out there really trying hard to reach out to medical schools and really trying to reach the research side of things, because that gives them more credibility as to whether or not they could be functional within a med school environment. And that's one thing we'll touch on later. All right, again, you have another paper on the recommendations for methodology of virtual reality clinical trials. This is by an international working group, and this was an iterative study. And this was on therapeutic virtual reality by Dr. Brandon Burkhead at Johns Hopkins. So his work is mainly centered around therapeutic VR and how it can be used as treatment for a wide range of health conditions, especially mental health conditions. And he actually came up with a proper framework, methodologically speaking. And it's just a sort of guide as to how you can start with the design process, interpretation, and then again, moving on to trials and so on. So it's a very good read. I quite enjoyed it. And it really touches on maybe perhaps a lot of things that I'm not able to touch on in this presentation because of the time limit. But if you're interested as a doctor to further look into how you could start with the creation process with, professionals in the VR field, VR developers, XR developers, and so on, then this is a very good read. Okay, now the big one, right? Another paper. This is also based from a research group at a university in the US called the University of Arkansas. And not sure if I pronounced that right, but this is a department of neurosurgery, and they're looking at, oh, hold on. Okay, something's up with the keyboard. I think I lied on it. Okay, but this is actually on the department of neurosurgery. They came together and they just decided, you know what, let's do an entire literature review. Let's put everything together. And so I really like these when they come together and they try to fish out all the different modules that already exist out there, and they try to kind of analyze them, get their hands on a few of them. Quite nice, especially when they're able to get different departments in on it. It's quite nice to know what physicians, and especially this might be, this is just a personal opinion, but physicians from different generations as well. It's quite interesting to hear what they think of VR and its impact, because really you get different responses depending on the physician you're talking to and whether or not they're familiar with this kind of technology already, which from what I've seen, and this is not based off of research or anything, this is just me, from what I've seen depends really on the age group, because that again determines whether or not they've seen this being used often in other areas. Right, okay. I wanted to also go over worldwide initiatives for medical students, and again, for really healthcare professionals that they could try and sort of maybe look into their workshops and so on in relation to artificial intelligence. Now, VR actually goes under AI, and so a lot of these initiatives do discuss VR from time to time. One of them would be, I'll start with the initiative we have at my college. So that would be the Artificial Intelligence in Medicine Student Journal Club. And so we do public monthly journal club meetings where we discuss the latest advances in the field. So students usually volunteer to cover whatever topic they're interested in, as long as it's within the realm of artificial intelligence in healthcare. And so they go dig deep a little bit and then they present. It could be on one paper that they found interesting and what they learned from that paper, the tech side to it, and the medical side to it as well, what they think, to critically really analyze it from a medical student's point of view, but also to have the help of experts in the field. So if it's a virtual reality related paper, then we would try and make sure that we have professionals or people with experience within that meeting to help them critically look at it. If it's machine learning related, of course, we have our faculty members And I think that's the most exciting part, is that there are so many discussions that you get to be a part of. You see a professor in machine learning discussing, let's say, a paper on related to cardiology with a cardiologist, with a med school professor, with med students, and with just enthusiasts. And so it's very nice to have space for these kinds of conversations. Again, all these other initiatives, I haven't tried all of them, but I've joined quite a few, Emory being one of them. So they do very nice work, very similar to ours, and they have their workshops, recordings. They also teach med students how to code. And that's something we are working on as well. So earlier on, I mentioned that the paper we published was proof that a medical student, given the right amount of time and the right amount of training, could also think, you know what, I think this would be an easier concept to understand if I could see it right in front of me. They could do that. And I'm saying this because we have med students in our interest group actively learning Unity, actively learning how to use Blender alongside their med school studies, purely for the fun of it, and again for research. And it's nice seeing how it's become a thing at our medical school. We even have machine learning integrated into the curriculum now, thanks to Dr. Susu. The amazing work on her side. She really pushes for the best in everyone. Okay, more worldwide initiatives. I thought this was very, very good to add in here. They don't really usually cover VR related content, but they do cover AI. And maybe in the next few months, you'll see a bit of VR related papers from my side, inshallah. And they basically try to interpret the tech behind each paper so that it's more readable. I think most of the audience here would have heard of the initiative, so I won't go too much into it. It's called explainthispaper.com. And then here, of course, I'll just, this is where we've almost reached the end, but this is a bit on how I integrated VR into my medical school journey as a med student. And I decided, you know what, there's a video from one of our PBL sessions that one of my friends took. Let me see if I could play it. Maybe I should just remove the laser pointer first. Okay. And there you go. So very short, we were actually covering the liver. So that entire week was on the hepatic system. And I took anatomy as usual. And I tried to cover it using VR. So ideally what would happen is that you'd have another person or multiple people, depending on the number of headsets available, also with me within the same experience. And I would be explaining or piecing apart the liver. That's much better than, you know, just showing a 2D diagram on a presentation slide. Again, of course, because we might not have enough headsets for everyone. A typical group has what, 8 to 12 members in, and I can't carry 12 headsets with me to uni. Okay, all right. I think the share screen stopped, but let me just.
We have a limit on our Zoom.
Oh, all right. Okay.
That's the only reason.
It was just that really. I think that was actually our last slide, so that's fine. But
no, so it's really great what you've achieved. I mean, if I look back to what I was doing as a medical student, I don't think I did half of what you've done. Not only in the tech space, but also through academic writing and conferences. So you should be very proud of yourself. And definitely, I see a bright future for you mixing medicine and virtual reality, which is incredible.
Thank you very much. That means a lot to me coming from you. And honestly, it's an honor for me to be on this platform today, speaking with the clinician engineer himself. So that's very exciting to me. I remember the very first time we spoke was on a Twitter space, I believe, with Faisal.
That's correct. Yeah, absolutely. Yes, we continue to grow.
And ever since I was like, oh my God, clinician engineers, there is a platform like that. I had no idea that there was an entire platform dedicated to mixing medicine and engineering together. And so it's like
I, th-
mind
I
blowing.
think, I think we're trying hard to get the word out there. Still a lot of work to do, and I'm getting quite old and tired, so I need to pass it on, I think. So Faisal and yourself definitely can take over. But yeah, I don't have any questions at this time. Obviously, I appreciated that through VR, definitely what I've seen through the medical education space, also chronic
I'll
pain.
just
Particularly
join
initially.
with the cool tech.
Yes, this is my
Yes.
virtual reality fake headset and glasses, like I
You
mentioned.
know, I might give you like a small let's call it a tour, what this consists of, right? So I'll just piece it apart. So you have this right here.
Yes.
Oh,
we have a
question. Yes, can we expect surgical training via VR in CMed? In the virtual reality section, it's already happened 3 years back and it's still happening. So just pop by, it's in the library, pop by and you're free to practice whatever surgery we have available. In CMed, that's a lot of admin. And I don't like dealing with admin. So we'll have to wait a bit on that.
You have another question, yes, right?
Okay, so thank you so much, Yusra. Yeah, you've done a lot of student well done, and thank you. My question is about the role of VR in clinical studies. How would VR help with clinical trials? So thank you very much, Sarah, for the question. Now, there was a specific slide in my presentation where I tried to kind of look into that. I don't know if I can share screen again, but I'll just very quickly try to take you through. Now, virtual reality actually has a huge place in clinical trials. I don't exactly know what you mean by clinical trials. Do you mean clinical trials related to drugs or clinical trials related to, simulation? Because that's a broad term, but I believe that virtual reality has a place everywhere. So let's take drugs, for example. I haven't seen anything on VR being used in drug-related clinical trials just yet. But I can imagine it being used to put patients in a certain or specific mind state. So let's say you need a patient to relax or be at a specific, or somebody that's relaxed per se or is, I think the right way to look at it maybe is you want everybody to be at the same base level. Maybe you want a person to have a certain mindset, in a sense, from a psychological point of view. I'm not exactly sure how that would go, thinking off the top of my head. Maybe you want everybody to have like a heart rate within a specific range. You want to make sure everybody in a specific age range is at the same level. But then again, in clinical trials, I can imagine VR being used a lot in therapeutic clinical trials. So as we've already talked, there's a lot being done right now in terms of VR and the use of for depression, for anxiety, VR even being used to help the elderly cope with certain situations. And that actually makes me think you could do a trial on using a VR module with antidepressants, let's say, or some form of medication versus without. Although I imagine there would be a lot of IRB forms involved. But
Yeah, absolutely,
yeah,
they always are.
that makes me think you could do a lot if you get through the paperwork, for sure. So you have that.
Yeah, definitely. I think that's one thing that also is important to mention, the ethics and regulation around VR. Because any
I hope I answered your
out
question, Sada. If you need any clarification on anything, really, I'm here. And I think until we see if all's good, we'll continue our little piecing it apart thing. So right from here, I don't know if you can see, but these are the lenses, right? And so I'm able to actually adjust the lens spacing. So for me, ideally they would be apart. My eyes, they're quite, they're not really that close, and it really depends on your eyesight, but you're able to adjust things. You can actually open this up from the inside, but it requires a bit of, you need the whole kit. And you can see on the inside, but right around here, you have that's your main sensor. And so sometimes I like to trick the sensor and cover it up so that it thinks that I'm using the headset whilst I'm not. And this really helps when I'm working on creating a module and I want the VR headset to stay on. I want it to think that I'm actually in it when I'm not. And yes, Dr. Susu Itqan Center has VR-based surgery training in Hamad. So Hamad Hospital is the major public hospital system in Qatar. They have a whole simulation center dedicated to this kind of thing. Then again, here you would have this is where, you know, if you want to like add in a headset or so, you just add it in here. Usually you'd use like small wired ones, like the ones you're wearing now, maybe a bit shorter. I just use my Bluetooth headset. It makes life easier, makes everything a lot easier. Again, your cameras and motion sensors right around here. And that's really it. You also have your controllers. They're a bit far. Don't know if I could reach them. They're a bit far, but basically they're two controllers, like I showed in the slide, and they just controllers come in all sorts of sizes and shapes. And you could even, in a sense, I've seen people create their own controllers that suit them better for whatever game they're trying to play, and then tricking the Oculus headset or whatever brand they have into thinking that, you know what, this is actually the controller that comes with the brand. But the coolest thing so far, and I believe this rolled out in the latest update with the Oculus Home, is that right now they support using Mac keyboards and I think Logitech keyboards within VR, plus Bluetooth devices, so maybe a Bluetooth mouse. So I could, in a sense, pop on my headset and I could do Anki cards in my nice virtual home and pretend that I'm not studying at home for a while. Or I could work on a few of my med school tasks. I've tried doing that before. It's not for the faint-hearted because you have to really have, I don't know if there's a term for this, but the stamina or how long you can last in a VR headset. When you're creating modules on the go, you kind of get used to the feel of a headset around your face, as well as, you know, the fact that in the end it's still an alternate reality. It's not exactly what reality is. So if you're not really used to it, I don't think you could last past an hour and a bit, from my experience with, you know, training people to use surgical modules and, you know, all sorts of other games. But I've tried, my max has been 3 hours. So don't know if anybody could beat the score. I think we might have a few, but let's see.
Fantastic. Well, thanks again for your time. It's been a brilliant
Thank you for inviting me. I'm quite honored to be here again. It's a pleasure being here presenting Qatar University as well.
Definitely.
And I hope you found the talk useful. I hope that I was able to at least give some form of introduction as to VR and its use in clinical medicine. Again, there is so much more to it than the few slides I had today. And I'll try to actually share some of the references, perhaps on Twitter or by email, just for anybody that's interested. I especially recommend one of the papers on, it was one of the scope reviews that I showed. I think I'll post it on Twitter. That would ensure like a higher reach, maybe.
No problem. Fantastic. Yeah. Well, thanks once again, and have a great
evening. Thank you for inviting me, and thank you to the audience for
absolutely. And for those of you that couldn't attend, this video will be available on our YouTube channel, so it can be watched and we can educate ourselves continuously. So thanks once again, Yusra.
And thank you. Nice meeting you. Have a great evening ahead. I believe it's 4 p.m. right now in the UK?
Just after 4 p.m. Fantastic.
Oh, okay. It's exactly 6 p.m. here. So
perfect. All the best to you. Take care.
Thank you. Take care.
Take care, everyone. Bye-bye. Bye.